So UF Cares is the only one-stop shop comprehensive program serving all ages, all genders of HIV infected and HIV affected population in North Florida.
We serve about 1,200 adults annually and anywhere between 400 to 500 children, adolescents. Other than primary care, we also have dietitians that are working with our patients. Then we have a pharmacy that's on site. And then we also have outreach services, and we do provide mental health services to those patients that are in need of counseling.
It has come a long way. I've seen it go from a patient taking 20, 25 pills per day to now just one pill a day or one injection a month or every other month. So we have come a long way.
The first Sentinel event was in 1994-95 when we were able to offer prevention treatments to pregnant women so the infection is not transmitted from the mother to the baby. That was a national program, but it allowed us here in North Florida to decrease the transmission rate from mother to the babies so much that we haven't had a transmission from mother to a child in our program for over 25 years. So research has been a critical part of what we do at UF Cares, and we have been participating in research for the last 30 years. We are funded through the National Institutes of Health, many pharmaceutical industry studies that we've done here. We also do our own investigator-initiated studies and multitude of other funding sources we have for doing these studies.
So sometimes the research would be like PK, for instance, or side effect of medications are new on the market. And when they do research, post-marketing, whatever findings, they can update the investigator brochures with that information, side effects or dosages. For clinical care, it's also important because a lot of the research studies would find whatever the finding is implemented in clinical care.
So pharmaceuticals are extremely involved with us through a lot of our clinical trials and studies. They also have patient-assisted programs set up. So even when patients have difficulties buying or purchasing medication because they don't have any other funding or they have no insurance, anything to cover it, pharmaceuticals have assisted those particular patients to receive treatment.
We offer our patients various ways they can get access to their medications. It can be mailed to their home. If they don't want it to be mailed to their home, it can be mailed to our site here and we can deliver it to them, or they can come pick it up. They can go to any of the multiple pharmacies in town which we have relationships with to pick up their medication. They can also pick up their prescriptions right here when they are visiting us because of the pharmacy we have. It's so important for them not to miss the medications on a regular basis.
We love MedCenter. Our patients have benefited from it greatly. They see the provider puts in the orders, and they go down the hall, pick up their medications, and they're on their way. They don't have to stop by a retail pharmacy and wait. For the adolescents, the problem we see with them is adherence. They're typical teenagers, so trying to get them to stay in care and take their medications is a big problem with them. But we have case managers who work diligently with them to keep them in care and encourage them to take their medications. Social services, to me, is the heartbeat of the program. Social services address the needs of the client, whether it be food, shelter, financial services.
The biggest challenges is transportation. Some have cars, some have to catch the bus, some have to get an Uber or other transportation, which is not reliable to help the patient get to the appointment. If they're homeless, they're not going to take their medication. They're going to lose it, because they're going from place to place, trying to sleep. And lo and behold, they lose the medication. Then they got to try and get it all over again.
We offer transportation, so any patient anywhere, either they can take the bus or we can give them a taxi. We offer utility assistance. We don't want our patients' power to be cut off. Many of these patients are fragile. We offer rental assistance, where they can, they're not worried about those real life issues.
A lot of the patients don't want to tell their partner they have HIV, or they don't want to tell their family because they'll be discriminated against, and so there's a lot of still stigma in the community.
HIV infected and affected individuals face so many challenges, so many adverse events in their lives, that mental health for them is critical. And for decades we have provided mental health services in different forms to our patients.
In the future, I think we're going to have more long-acting medications for our HIV patients, and hopefully maybe vaccine for HIV, and hopefully I think more awareness about HIV transmission.
For me and many of my colleagues, my team members, this is not just a job, this is not just a profession, it's our passion. We are committed to those patients, and that's why we have people working with me in this program for 25, 26, 27 years. Our biggest strength is not the medications, it's not the lab test we can do, it's our team, our staff.
I have lost family members to it. My being a peer navigator / family supporter is to be there for the patient. When they come to UF Cares, I want them to feel that we are the best in the United States. We're gonna give them the best of care. We're gonna treat them just like they are our family. Work with me, because I'm gonna work with you. And we in this family together. Just look me up. That's how I talk to them. Call me, I'm there for you.